In our IVF clinic, basically we reach sometimes a little bit higher than the normal success rate in all over the world. Especially for the patients, of course, this success rate depends up to patient's situation and specifications and things like that. For example, if the patient is young and so the success rate comes up to 70% if we do IVF plus some genetic examinations, then it becomes to 80 to 85%. And of course, for patients like over 35, and especially after 40, unfortunately, this success rate decreases depending up to their wishes. Of course, I mean, if they fill with their own eggs, around like 20 to 30% with their own eggs if they are over 35.
Okay, thank you. Yeah. What factors affect IVF success the most? So only age or egg quality, sperm quality. So can we say in total, or just might be many of effects? If you explain us a bit more. So what is affected? What factors affect?
Well, of course, in fertility, there are three main issues that we have to deal. First of all, one of them is sperm. Sperm belongs to the man, of course, and the quality of the sperm, which can be checked with the amount of the sperm, which is the count, how many, and the movement of the sperm, and also the morphology of the sperm. As long as these are over or at least enough situation, in that case, it is important, of course, to have this. Second, the oocyte quality is important. As we have said before, the oocyte quality also affected by the age and some other endocrine situations and the capacity of the oocytes depending up to some past surgeries and some illnesses like as tuberculosis and infections and things like that may also affect the quality of the oocytes. And what we need is, of course, a good quality of oocyte. And the third part is the uterus, which is known as the womb as well. The uterus also have to have a smooth situation, and it should not have polyps or any myomas which affects the endometrial cavity. These are the three main issues that we have to check, and we have to that also affects the possibility of getting pregnant. For example, in male infertility, it is a little bit rather hard to have the success rate because unfortunately there is not really a real therapy for sperm. There are so many things that could be done that are used, but none of them are proved that they are effective. None of them have, in evidence-based medicine. It's not shown that it's effective. Of course, a pregnancy can be successful even with only one sperm. When we talk about sperm, we're talking about millions, like as normal persons that have 40, 50 millions up to 100 million sperms. But infertility becomes only from one sperm from those. So this is also important part. And for the ovaries and the oocytes, the same thing. Yes, you may be, old, but you still might have a good oocytes, and at least in that period, if it is a good oocyte comes out, then again the pregnancy might appear. For the uterus, basically, it is preferred to have minimal invasive surgeries. comparing to last year, comparing to years before. For example, myomas. For the myomas, if it is not affecting the endometrial cavity, we don't touch them. The medicine, universal medicine, say that don't touch them, don't hurt the uterus, because it will also affect the blood coming to uterus. So as long as it's good, then we don't touch it. Of course, some polyps, for example, up to 1 centimeters, it's said that they are not a reason to become for unsuccessful tries. But still, after trying, for example, 2 or 3 times, and then if there is only one reason that you see, then it's the polyps, then we have to move the polyps. And also the tubes are important. The tubes, of course, we don't need tubes during the IVF therapy, but if the enlarged tubes, especially what is known as the salpingitis or sanctosalpingitis, which is inside the tube, there are water, there are fluids inside. In those cases, in some cases, of course, we have to move the tubes and then try the IVF again. These are the things I guess I believe I would say for this subject.
Yeah, thank you very much, Hocam. How many embryos do you usually recommend transferring? 1 embryo, 2 embryos, 3 embryos sometimes?
Of course, the number of the embryos are also important for the success rate. There is not a restriction at the moment in Azerbaijan for that. Generally, we prefer to transfer at least 2 good embryos, but sometimes we add average embryos to these 2 good embryos. 3, 4 embryos we might transfer as well. Transferring more embryos has also a risk, because multiple pregnancies are always a risk to having a healthy baby. For the take-home baby rate, it is very important. So you have to consider it according to the situation of the patient.
Thank you very much. What is the difference between fresh and frozen embryo transfer?
Before, maybe I would say 2, 3 years before or 4 years before, we used to wait for the embryo to become on the 5th day and transfer it fresh embryos on the 5th day, or we tried to do more fresh cycles. But in the last 3, 4 years, this attitude has been changed. Now we prefer to have, if we have the good quality of embryo, then we prefer to transfer it in the frozen cycles instead of doing it on the fresh cycles. The reason for that is during the fresh cycles, of course, your control over the endometrium and the uterus is not as good as when you have it with the frozen embryo transfers. So in order to have a better result, basically we prefer to do frozen embryo transfer. But of course, there are some other issues that affects our chances. For example, the quality of the embryo is not as good than freezing and thawing these embryos. Freezing and defreezing these embryos might affect the quality of the embryo. So that in those cases, we prefer to do it fresh embryo transfers. Male infertility, we prefer fresh embryo transfers. And also, if the patient is young, and in that case, if there are more than 10 oocytes that we have collected during a cycle, in that case, we prefer to do frozen embryo transfer. This depends up to patient's situation.
Thank you. We are now open the QA session. You can write your questions in the chat, and our doctor will be happy to answer them. I will carry on to ask some questions more, but we are expecting some questions from the patients. So as soon as I get good questions, I will ask you. Okay. How many IVF attempts are usually needed for success? When we start to IVF treatment, is that in first time it's gonna be work, or second time, third time, depends on what?
Well, that's also again, I don't know what to say about this and how could we explain this issue. But for some patients, on the first attempt, it becomes positive. Of course, if the embryo is good quality and if there is no problem with the uterus, then the possibility of success rate on even on the first attempt is really high. Generally, and statistically, it is said that 40% of the IVF cycles are successful on the first attempt. But of course, for some patients, the success comes repeating attempts, and from those, we have to think something like that. You never give up. You shouldn't give up. As I always say to my patients here, if one of my patients gets pregnant on the 15th attempt, that doesn't mean that we have made something wrong to him, to her, 14 times. But this is how it goes. And as long as you trust your team, as long as you trust the center you are applying, I mean, it may be. It's not in doctor's hand. Unfortunately, this is the worst part of being an IVF doctor. Sometimes, whatever you do, whatever and however you do, you work and you do your best, but didn't come out anything. And sometimes you think that it's going to be quite hard to catch the success, but it comes out.
Right. Thank you very much. We got some questions I would like to ask you from Tanzila. Hello Tanzila. I know you. We were over the phone a couple of days ago. She asked success rate for egg donation.
Of course, egg donation is something different. If there is no problem with the sperm, basically in egg donation patients, sperm is normal, and if the sperm is normal, and if the uterus is normal, then the success rate rises up to the young woman's success rate, which is around like 70-75%.
All right, thank you. I got another question from enormous attendee. What are diet chance in female or success of embryo?
Pardon me, can you repeat the question, please?
What are diet chance in female for success of embryo? Diet.
You mean eating habits, right?
Yes. Yeah.
Okay. Well, this is another issue. There are many things that comes to this subject with regards to not only the diet and how you feel, how you act after transfer, and what is the your daily life and things like that. If the medical, universal medical says that, I'm talking about also stress and things like that. As long as yours are normal, in the normal, if your diet is, if you are not a vegetarian, if you are not, even if you are vegetarian, it's not that affectable, but if you are eating normally, and if you have been eating, and if you have your diet habits since for a long time, that they do not really affect the success rate. There are so many issues right now in the subject. For example, vitamin D levels. People are thinking that we have to take vitamin D and we have to careful about our diet containing vitamin D, or some for the sperm, the zinc and these type of chemicals. None of them are really proved, according to evidence-based medicine, are really effective. So what I recommend is, as long as however you feel is the fine way. I mean, you don't need to change, and you don't need to take extra things. You can imagine there are so many women that become pregnant unintentionally or without really wanting it, but they become pregnant. And if it is effective, then they will change their diet, and then they will lose the baby, or they won't get pregnant. But this is impossible. I don't know if I explain myself, but of course I'm talking about normal diet. I mean, if you are not eating something specifically, then it might affect. It's still not
might affect
complete.
only egg quality or something.
Yeah, right.
Okay, thank you very much, hocam. Another questions. I got many good questions. Thank you very much for everyone. I have to just go through quickly to answer all questions. In case from Darman J, thank you very much. In case of PCOS, polycystic ovary syndrome success rate, age is 36 and AMH is 7.5.
Okay, maybe Ms. Dr. Latife would like to answer this.
Yes, sure.
Have a break. Have a break, yeah.
Okay.
So in case of PCOS, actually, it means that you want to do your own eggs, IVF with your own eggs, and we do expect to have lots of eggs coming up from you, and it means probably more embryos, which makes it a very high success rate. But considering your age, 36, it is still fine regarding the egg quality. So I think it will be maybe 40% success rate from the first time.
Yeah, and same patient ask again, I think is related, that success rate of PGT-A tested embryo transfer. So if they do a PGT test, and what's going to be the success rate? Of course, it's going to be higher, isn't it?
Yes, it will be higher, much higher. So because you will know exactly if the embryo that you transfer is chromosomically normal or not. So it does make it higher. It does not make it better, the embryo, the PGT testing, but you will know exactly the
healthy embryos. We can choose the healthy embryos. That I was going to carry on with PGT questions. Just after these questions, can we carry on with you, Dr. Latifa? So can you please explain what is PGT is in simple terms? So what is PGT and how accurate is gender selection with PGT? Can you please talk about it a bit?
Sure. So when we do the egg retrieval, and the same day we fertilize the eggs with your husband's, with your partner's sperm. On the day 3 of embryos, our embryologist will take a piece of all of the embryos and send them to the testing. That testing, PGT-A testing, will show us their chromosomically normal and abnormal embryos. So, for example, it will be either XX or XY 46, and if there's some abnormalities, it will say that it's euploidy, or there's some missing chromosome like Down syndrome, Taranersky syndrome, and those Klinefelter. It will show us that PGT testing.
All right, thank you very much. Can we carry on?
It is accurate.
Yeah. Okay. Thank you. I think is your line is bit poor. So can we hear?
I'm hearing you.
Yeah, sorry.
Right. Yeah. Can we please carry on with you, doctor? Because I think her line is bit low.
Yeah. Okay. Sure. No problem.
Yeah. So another questions came through. Thanks for questions. Can I take folic acid during my IVF cycle? What is the role of folic acid? It is good questions. Thank you.
Yeah, well, folic acid is a substance that is known that affect the quality of the pregnant embryo. I mean, if the embryo becomes pregnant, it helps for some tubal effect on the embryo. So it is not related specifically to the success rate of the IVF. It is related to if you get pregnant, for the pregnancy to be sure that for some sicknesses related